This video will show you how to store reusable medical devices (RMDs) in sterile storage while keeping them sterile. I will go over the many precautions that need to be considered when storing RMDs safely in this video. In order to preserve the sterility of sterilized products until they are used, AS NSS 4187-2014, the industry best practice, requires a methodical approach to storage. This standard specifies the method for reviewing records and releasing an RMD after the cleaning, disinfecting, packaging, and sterilization steps. Identification of the item. To enable the sterilization of an RMD or RMDs, packaging is placed around them using a sterile barrier system (SBS) by stopping microorganisms from entering a sterile RMD and enabling aseptic presentation of the RMD at the site of use. An SBS plays a crucial part in maintaining patient safety. In order to determine the RMD, the technician should visually inspect it using the sterile barrier system type as a guide. Batch sticker. A visual reference to the sterilization state of the RMD can be obtained by monitoring the color change of the chemical line on the label following a successful cycle. The label's barcode provides comprehensive set information. Packing intact. Before being moved to storage, the package must be inspected for damage. Verify that sealed pouches are intact, the rigid containers are free of damage, and the wrapped RMDs have no holes in them, no moisture. Before being placed in storage, the disinfected RMDs must be guaranteed to be free of moisture. After the cooling time has passed, this check is completed. Tapes, seals, locks in place and tamper evident. Locking mechanisms used in the sterile barrier system include lock for rigid containers, seals for sealed pouches, and tapes for sterilizing wraps. Until it is interfered with, these methods maintain sterile field. Any packed RMD that is discovered to be non-conforming must be recalled and sent back for reprocessing. The package label will be scanned in order to extract the data and provide the recall reason. After that, the RMD was repackaged and sent to be sterilized. To ensure that reusable medical equipment are sterile at the time of use and prevent the spread of bacteria and subsequent infection, it is essential to maintain the integrity of sterile stock. Rotating stock involves using methods like use from the left, restock from the right, or use from the front, restock from the rear to ensure that the oldest package is utilized first while handling sterile stock. We adhere to use from the front, restock from the rear at Waikato Hospital. When a package is about to expire, it is identified with a red dot sticker for increased visibility. If it has expired, it is removed from stock and can be processed again. Every precaution must be taken when handling processed RMDs to make sure that nothing gets contaminated or damaged. It is necessary to wash your hands before handling released RMDs. Any surface that processed RMDs are put on needs to be dust and debris free. RMDs should be handled as little as possible. If more than one must be handled, they must be handled with the aid of a trolley. To make heavy trays simpler to lift and to lessen the possibility of damage during handling, a mesh tray or plastic tray must be used to limit direct contact between the RMD and the surface. All sterile stock need to be kept dry, dust-free, and clean throughout the storage. Drawers must be deep enough so that pouches are not damaged by opening and closing. Keep bags, pouches out of sunlight because it can affect the integrity of some type of sterile barrier systems. Establishing a setting that reduces the chance of contamination after sterilization is emphasized in AS/NSS 4187-2014 standard. To stop microbes from growing, Sterilized objects should be kept in dry, clean, and well ventilated areas. Adequate shelving and storage options should be used to allow for simple retrieval while reducing the possibility of physical damage or crushing. It is crucial to regularly check storage rooms for cleanliness and protocol complaints. Compliance with these storage methods can be verified by regular audits. Following these industry best practices guarantees that sterilized products are easily accessible, retain their integrity, and adhere to the strictest infection control requirements in line with AS/NSRS 4187/2014 recommendations. Thank you.